She went to bed feeling perfectly fine. No chest pain, no shortness of breath, no warning. She woke up at 2 in the morning with a crushing pressure across her chest and her left arm completely numb. Her husband called 911. I was the cardiologist on call. We got to her in time. But here is what I have never forgotten about that night. Every single thing that damaged her heart happened while she was asleep. Not at the gym, not under stress, not after a heavy meal, while she was lying quietly in her own bed. And the habits that put her heart at risk that night are habits that millions of seniors repeat every single evening without knowing what those habits are doing to their cardiovascular system in the dark. Tonight, I am going to show you exactly what those habits are. And more importantly, I am going to show you what to do instead. Stay with me. Hello and welcome back. I am Dr. Carter, and this channel exists for one purpose: to give adults over 60 the honest, verified, evidence-based health information they deserve. Today we are talking about something that does not get nearly enough attention in senior health. What happens to your heart while you sleep, and why the choices you make in the hours before bed and during the night could be among the most consequential health decisions you make all day. Before we get into the specific habits, I want you to understand the foundation of why nighttime is so critical for your cardiovascular system. Because once you understand the physiology, everything else in this video will make complete sense. Your heart and blood pressure are not static. They change constantly throughout the day and night, following patterns governed by your body's internal clock, which is called the circadian rhythm. During healthy sleep, something critically important happens. Your blood pressure drops. Typically, it falls between 10 and 20% below your daytime level. Cardiologists have a specific name for this. We call it the nocturnal dip, and that dip is not a luxury. It is a biological necessity. It is the window each night when your heart gets to rest, when the arteries get to recover, when the cardiovascular system repairs itself from the demands of the day. Now here is the problem. According to research published in peer-reviewed cardiovascular journals, a significant percentage of older adults do not experience that protective blood pressure dip. Their nighttime blood pressure either stays elevated or in some cases actually rises. This condition is called nocturnal hypertension, and research has documented a 21% increase in cardiovascular mortality for every 10 mm mercury increase in systolic nocturnal blood pressure. That is not a minor statistic. That is a profound risk that most seniors are never told about because most doctors only measure blood pressure during daytime office visits. What causes nocturnal hypertension and what puts your heart at risk during the night? Let us go through the 5 most important factors, all of them verified by current cardiovascular research. Risk factor number 1, sleeping with the lights on or in a room that is not dark enough. This one was confirmed by landmark research published in late 2025, and it surprised even practicing cardiologists when the data came in. A large-scale study published in JAMA Network Open analyzed data from over 88,000 UK biobank participants with an average age of 62 years and followed them for nearly 8 years. The findings were striking. Participants who were exposed to the brightest light environments at night had significantly greater risks of coronary artery disease, heart attack, heart failure, atrial fibrillation, and stroke compared to those who slept in the darkest environments. An increase in nighttime light exposure by 1 standard deviation raised the risk of all 5 cardiovascular outcomes by approximately 5 to 8%. Harvard researchers commenting on this study noted it adds nighttime light exposure as a novel and modifiable risk factor for cardiovascular disease, meaning it is something you can change tonight. Here is the mechanism your body uses to understand this. Your body regulates its cardiovascular rhythms in part through a hormone called melatonin, which is produced by the pineal gland in the brain. Melatonin signals to your blood vessels and heart that it is nighttime, time to slow down, time to let blood pressure drop. But melatonin production is suppressed by light. Even dim light from a television, a night light coming through curtains from street lamps, or a glowing phone screen on a nightstand, suppresses melatonin and disrupts the body's nighttime cardiovascular recovery process. The circadian rhythm expert, Dr. Mark Siegel, summarized it clearly. The body's internal clock is geared to sleep in darkness. That is when stress hormones decrease, when the brain cleanses itself, and when the cardiovascular system enters its restorative mode. The practical fix requires no medication and no expense. Make your bedroom as dark as possible before you go to sleep. Use blackout curtains or blinds if light comes in from outside. Turn the television completely off rather than letting it run while you fall asleep. Cover any LED indicator lights on electronics in the room. Put your phone face down, or better yet, in another room entirely. These are not suggestions for comfort. They are cardiovascular protection measures supported by large-scale human research published in 2025. Risk factor number 2, irregular sleep timing. Most people focus on how much sleep they get, but a growing body of research published in top cardiovascular journals shows that when you sleep and how consistent your sleep schedule is may matter just as much as how long you sleep. A study drawing on data from over 72,000 UK biobank participants between ages 40 and 79 found that an irregular sleep-wake cycle was associated with a meaningfully higher risk of major cardiovascular events, including heart attack and stroke, even among people who were getting the recommended number of nightly hours. The research used objective wrist-worn activity trackers rather than self-reported data, making the findings particularly reliable. A separate study published in January 2026 in the Journal of the American Heart Association, examining 14 years of UK biobank data for approximately 300,000 adults, averaging 57 years old, found that adults who were consistent evening types, meaning they went to bed late and woke up late, had a 79% higher risk of poor cardiovascular health scores and a 16% increased risk of experiencing a heart attack or stroke over a 14-year follow-up period compared to morning-type individuals. Why does sleep timing matter so much? Because your cardiovascular system operates on a precise internal schedule. Blood pressure regulation, hormone release, heart rate patterns, vascular function, all of them are timed to the 24-hour circadian cycle. When your sleep timing is irregular or persistently late, there is a mismatch between when your body expects to be resting and when it actually is. Your blood vessels do not relax on schedule. Your stress hormones do not drop on schedule. Your heart does not get the timed recovery window it was designed to receive. The American Heart Association published a scientific statement on sleep and cardiovascular health, confirming that consistent bedtime and wake time, along with uninterrupted sleep, contribute meaningfully to cardiometabolic health and reduced risk of heart disease, stroke, high blood pressure, and atrial fibrillation. The practical guidance is straightforward. Pick a bedtime and stick to it 7 nights a week, including weekends. The target for most adults over 60, according to the AHA scientific statement, is 7 to 9 hours of sleep per night. Getting fewer than 7 hours consistently increases risk of atrial fibrillation and elevated blood pressure. Getting more than 9 hours consistently is also associated with increased cardiovascular risk, including stiffer arteries and higher stroke risk. The goal is the middle ground, consistent, adequate, timed sleep. This is the one that I believe carries the highest unrecognized cardiovascular risk for seniors, and the statistics around it genuinely alarmed me when I reviewed the current research. Obstructive sleep apnea is a condition where the airway partially or completely collapses during sleep, causing repeated interruptions to breathing that the person is often completely unaware of. Each interruption can last 10 seconds or longer. In people with moderate to severe sleep apnea, these interruptions can occur dozens or even hundreds of times every single night. Here are the verified numbers. A 2025 peer-reviewed meta-analysis found that obstructive sleep apnea is linked to nearly twice the risk of cardiovascular disease, stroke, and all-cause mortality. In cardiovascular clinics, sleep apnea is found in approximately 40 to 80% of patients with hypertension, heart failure, coronary artery disease, atrial fibrillation, or stroke. And in patients with resistant hypertension, meaning blood pressure that does not respond adequately to medication, up to 80% have undiagnosed sleep apnea.
During sleep apnea, breathing stops, causing oxygen levels to plummet. The brain detects the drop and triggers an adrenaline surge. This causes blood vessels to constrict, spiking blood pressure and heart rate.
Drop and triggers an emergency stress response. Adrenaline surges, blood pressure spikes, the heart rate jumps. This happens over and over throughout the night. Every single interruption is a small cardiovascular emergency. For an older adult with any degree of arterial stiffness or plaque buildup, repeated nightly surges of this kind are a serious and sustained attack on the heart. The American Heart Association's scientific statement on obstructive sleep apnea and cardiovascular disease specifically recommends screening for sleep apnea in patients with resistant or poorly controlled hypertension, recurrent atrial fibrillation, heart failure, and in patients who have cardiac events that occur at night, such as nocturnal angina or nighttime arrhythmias. What makes this particularly dangerous for seniors is that the classic symptoms of sleep apnea, loud snoring and witnessed breathing pauses, are often absent or less obvious in older adults. Many seniors with significant sleep apnea report only fatigue, poor sleep quality, difficulty concentrating, or waking frequently during the night. None of these symptoms by themselves sound alarming enough to prompt a doctor's visit, but they may be signals that the airway is collapsing repeatedly each night and the heart is paying the price. If you snore, if you wake up tired no matter how many hours you spent in bed, if you have high blood pressure that your doctor describes as difficult to control, if you wake up with headaches, please ask your doctor specifically about sleep apnea testing at your next appointment. A sleep study can be done at home. The diagnosis is straightforward, and treatment, most commonly a CPAP machine that keeps the airway open during sleep, is effective and has been shown in clinical studies to meaningfully reduce blood pressure, reduce atrial fibrillation recurrence, and improve cardiac function. Risk factor number 5. Going to bed mildly dehydrated every night. This one connects directly to the cardiovascular risks that accumulate while you sleep, and it is one of the most consistently overlooked habits in all of senior heart health. Throughout the evening hours, especially if you have deliberately reduced fluid intake to avoid getting up during the night, your blood gradually becomes more viscous and concentrated. By the time you are lying down and ready to sleep, your blood may already be measurably thicker than it was in the afternoon. Thicker blood requires more effort from the heart to pump. It moves more sluggishly through the smaller blood vessels, and it clots more readily. Research has confirmed that clotting factors reach their highest activity levels in the early morning hours, contributing to the well-documented clustering of heart attacks and strokes between 6 and 10 in the morning. But that clotting risk does not appear suddenly at 6 a.m. It builds throughout the night as dehydration progresses and blood viscosity increases during the hours of sleep. For seniors specifically, this risk is amplified by a well-documented physiological change that occurs with aging. The sensation of thirst diminishes. Older adults routinely underestimate how dehydrated they are because they simply do not feel thirsty the way younger adults do. The body's thirst signaling becomes less reliable. This means you cannot depend on feeling thirsty to guide your fluid intake. You have to drink on a deliberate schedule. The practical guidance is twofold. First, maintain adequate hydration throughout the day, so that you are not starting your night already behind. Second, drink a modest amount of water, approximately 8 ounces in the hour before bed. Not so much that it disrupts your sleep with bathroom visits, but enough to prevent your blood from thickening significantly during the night. What to do tonight? The 5-minute nighttime protocol. Now let me give you something concrete to carry out of this video, because information without action is simply worry, and I am not here to worry you. I am here to equip you. Starting tonight, here is a 5-minute protocol for protecting your heart while you sleep. At least 1 hour before bed, turn off the television and dim any bright lights in the room where you will be sleeping. This begins your melatonin production and signals your cardiovascular system to start its nighttime wind down. The research from Harvard and JAMA Network Open is clear. Darkness is a cardiovascular medicine. At bedtime, make sure your bedroom is as dark as you can make it. Curtains closed, electronics off or covered, phone in another room or face down with notifications silenced. Your heart will benefit from this every single night. Before you get into bed, take 3 slow, deep breaths. In through the nose for 4 counts, hold for 2, out through the mouth for 6 counts. This activates the parasympathetic nervous system, the calming branch of your nervous system that lowers heart rate and blood pressure. It is one of the most powerful tools for cardiovascular protection available to you, and it costs nothing. Drink 8 ounces of water, not immediately before lying down, but in the 30 to 60 minutes before bed. This moderates the nighttime thickening of blood that accumulates during sleep and reduces the cardiovascular burden your heart faces during the early morning hours. Commit to a consistent bedtime, same time every night within 30 minutes. This is not a suggestion for sleep hygiene. It is a cardiovascular prescription based on current AHA research showing that irregular sleep timing independently increases the risk of heart attack and stroke. And finally, if you have not discussed sleep apnea with your doctor and you have any of the symptoms I described, fatigue that sleep does not fix, difficulty controlling blood pressure, nighttime awakenings, morning headaches, make that conversation your priority at your next appointment. A home sleep test is simple, non-invasive, and could reveal a condition that is silently attacking your heart every single night. Let me bring this together for you clearly. Your heart does not take the night off. In fact, some of the most important cardiovascular repair and recovery of the entire day happens during sleep. But that repair requires the right conditions. Darkness that allows melatonin production and blood pressure to drop. Consistent sleep timing that keeps your circadian rhythm and cardiovascular rhythm aligned. An unobstructed airway so oxygen levels stay stable and your heart is not triggered into repeated stress responses. An eating schedule that allows your blood pressure to make its natural nighttime decline. And adequate hydration so your blood does not thicken to the point where clotting risk rises overnight. These are not complicated interventions. None of them require a prescription. None of them require new equipment beyond blackout curtains and a glass of water. What they require is the knowledge you now have and the intention to apply it. The woman I told you about at the beginning. The one who woke up at 2 in the morning with chest pain. She recovered fully. She came to see me for a follow-up appointment 3 months later, and the first thing she said to me was, "Nobody ever told me that what I do at night matters as much as what I do during the day." That question is why I make videos like this one. Because the information exists, the research exists. It is published in the American Heart Association's journals, in JAMA, in peer-reviewed sleep medicine literature. But somewhere between the research and the doctor's appointment and the patient at home, it gets lost. You now have it. Use it. If this video helped you today, please share it with someone you care about. A spouse, a sibling, a friend who is managing high blood pressure and has never thought about what happens to their heart during the night. You may be giving them something genuinely valuable. Subscribe to this channel if you have not already. Every week we bring you verified, honest, senior-focused health information cross-referenced with current research and presented in plain language. Because you deserve accurate information you can actually use. Take care of your heart tonight. It has been taking care of you without asking for anything in return for every single moment of your life. Give it the darkness, the consistency, and the rest it was designed to have. It is a fair trade, and it starts tonight. All cardiovascular information in this video is sourced from the American Heart Association, Scientific Statements on Sleep and Cardiovascular Health, research published in JAMA Network Open on nighttime light exposure and cardiovascular risk, the Journal of the American Heart Association Studies on Sleep Timing and Heart Disease, peer-reviewed meta-analyses on obstructive sleep apnea and cardiovascular disease, published in PMC and Biomedicines 2025, and PLOS ONE research on sleep patterns and cardiac outcomes using NHANES data. This video is for educational purposes only. Please consult your personal physician for guidance specific to your individual health condition and history.